And thanks for staying with us. Now, the Ghana Health Service has launched an ambitious long-term strategy that will seek to tackle malaria effectively by the year 2028. Now, how do they plan to achieve this? Joining us in studio now to discuss the strategic plan is Dr. Nana Yaupepra, the Deputy Programs Manager of the National Malaria Elimination Program. Thank you so much, Doc, for joining us. And let's start off with this whole strategy that you have, because malaria has been with us for quite some time. And we're just wondering what's new in this strategy or approach to eliminating the disease.
Thank you very much for having me. I think that we, together with stakeholders, we've observed the progress we have made over the years with some existing strategies. And we believe that with the new approach, where we have stratified the country, every district is designated a state. So you are either in the very low transmission area, low, moderate, or high. Then depending on where you fall, we have some strategies for you. So for instance, in areas where we have very low transmission, what is new? We're basically going to add mass drug administration. So in areas like this, we'll be giving people medicines to clear the parasite so that we can push those areas into elimination. And in these areas, we're also going to introduce a medicine called primaquine. And usually, you know, the parasites, especially the ovale type, is such that it can stay in the liver. And so there are some people who say they go to the hospital, they have malaria, it's treated about a month or two. It's like almost every month they are having malaria. And it could be the Plasmodium ovale. And for such species, we are introducing primaquine to clear them. We are also introducing what we call enhanced surveillance. We want to be looking at the cases closely as they come and then identify what the issues are. We are also going to enhance entomological surveillance. The mosquito that is transmitting, we need to understand the mosquito very well. And we are doing all that in the very low transmission areas.
Okay, just before we talk about the target, let's talk about where we are now as a country. How are we faring?
Good. I think if you look at the parasite prevalence, for instance, about 2 decades ago, we were about 50%. Meaning that if I sample about 100 people in Ghana, and if I take the blood samples, about 50 of them will have the parasite. In 2011, the survey estimated it to have decreased to 27.8, which means that we have made progress. The most recent one, which was done in 2022, it has reduced to 8.6. And that is really a drastic decrease in the reduction. And we are also looking at mortalities, for instance. Mortalities in 2012, we had recorded closely 2,700 mortalities. In 2022, we're looking around 151 mortalities. So we have made progress. And we are saying that even with the limited resources and the tools we had available, we have made this progress. Now, with a new approach and the new interventions we are adding on, we should be able to eliminate malaria.
And that's by 2028?
2020, this is the first 5-year plan. Yeah. We're actually looking at a 10-year plan to eliminate malaria. The first 5 years, we want to do something significant, and then we finish everything off in the next 5 years.
So let's talk about what's going to happen within the next 5 years. What's going to be top on the agenda for you?
I think top on the agenda is community ownership. We cannot eliminate malaria at the Ministry of Health or Ghana Health Service. Yeah. Everybody has to be part of it. And so we have to sell the agenda to people. People will have to own it, understand that even though this disease has been with us for long, it is time to end it. And we have the tools to do it. We need political commitment. We already have it, and we are hoping that we have more of that. And that is why during the lunch, we are having the president to come over. Political leadership will be there, ministers will be there to ensure that we get this commitment and get people to push for it. We also need resource. You know, as you add on new interventions, you need more resources. And we have private sector coming in already, but we need more. EcoBank recently joined us, and they gave a seed money of around $120,000. We are calling all the private sector to mobilize the resources available so that we can end malaria.
I see. In terms of financing arrangements and you know what you are in need of in terms of funding, would you say that you have enough, or perhaps you're still mapping out the strategies?
Yeah, so over the years, we have had roughly about 50% of what we need. And what we are doing now is to sell it to people. If, for instance, if a company comes and says that this district we have here marked for elimination, I want to own it.
Right.
You know, then we invest into it. So we have been able to mobilize some resource, but it's still not enough. We still have a gap of around 60% of what we need.
And how do you intend to make up for that?
People like so we need everybody on board.
Yeah.
We actually have focus on private sector because we believe that they really can help. We've started seeing some positive signs.
Yeah.
We also know that about 0.5% of the district assembly common fund is earmarked towards malaria control. Yeah. What we want to advocate is an increase. We were controlling and you're giving us 0.5%. Yeah. Now that we are thinking elimination, we need to have the increase and also have the efficient use of the resources. Yeah. So if we are getting all the resources we are having in the district being used specifically for what it is meant for, we should be able to achieve.
And one great thing you're talking about is the issue about community ownership, which possibly can make up for some of these shortfalls in revenue, because if then you have stakeholders from the community level joining the fight, then we can eliminate. What practical forms of support would you want to see from the community, or perhaps in terms of adherence to some protocols would you want to see as that national and collective fight towards eliminating malaria?
One of the objectives is to reduce the vectorial capacity. We shouldn't create environment around for the mosquito population to increase. So in our communities, if you are building a structure, you realize that you left it over a period of time, it's collecting, there's stagnant water, it's going to breed mosquito. We need to cover all these things up. We have gutters choked, you have containers in your homes and it's collecting water, you have to cover them up if you're not using it. So the communities will have to ensure that they don't create the opportunity for mosquito to grow. We have a number of interventions. We have to use them. In areas where we distribute nets, if you have the mosquito net, you have to sleep under it. Most of the countries that have eliminated malaria have used these interventions, and we know scientifically they work. We have areas where we spray the interior walls of the rooms where people stay, which we call the indoor residual spraying. If you are in areas where this is being done, allow them to come in and spray your rooms. And the way I look at you, I'm sure you can even apply for us to come and spray your rooms.
Yeah.
People should also do things like that. Yeah. And I believe that if we think about clearing or getting rid of malaria, we put in interventions like this. And let's have
maybe it's the issue of public education, isn't it? The fact that you're not educating enough. Do you feel you're doing enough of the education?
We are, but there's still more room for improvement. We work together with NGOs at the community level. We have health promotion units at the community levels, at the district levels, and we have you.
To always keep sharing the message with the people, and we are glad that you are here sharing that with us. So let's talk about, the people who are currently suffering the condition, or have some way somehow. Have been affected by this disease. Is it easy to recover? Because, the notion is this is not a big deal. It's something you'd recover and that's all. But do we find people in severe conditions dying out of this? And how seriously should we take this issue of malaria?
Worldwide, WHO recorded almost 600,000 severe malaria cases. In Ghana, we are also in the thousands. It means that you can get the severe form of the disease even though you have been in Ghana, and people are still dying. But we believe that at this point, people shouldn't die of malaria because we have the quality medicines to treat immediately you get to the facilities. So people are still having the complicated form of the disease. For those who travel outside the country for, say, more than 6 months and come back, when you are in endemic countries, you have some level of immunity. But when you come back after being away for about 6 months, you lose that immunity. So really you come and you get some few parasites.
Then you're off.
The bad form of the disease. And so we have to watch all those things. So we have to know that even though it is being with us, we want to end it.
But how about treatment and our facilities, public health facilities in, easily dealing with these issues?
Yes, so we have trained them. We have trained them to be able to identify a possible malaria case, or what we call the suspected malaria cases. So somebody comes with fever or history of fever with other symptoms like general malaise, weakness, headaches. You can suspect malaria. Yeah. When you suspect, you have to test. We have the RDT or the microscopy. We only advise that you treat when it is positive, because where we have gotten to, you have to know and confirm it's malaria before you treat. And so if you go to the facility, and in fact, even over the counter medical sellers and pharmacies, we are training them because they have to go by the standards. So we test if it is positive, and we treat.
I see. Any final message to our viewers, what they need to know about the strategy, and perhaps if there's any other message you'd want to share with them?
So on 16th of this month, next week Tuesday, we are going to launch the strategy. We want to hope that as we put this out, people will have access to it. We're also going to get to the regions and the districts, get the message across to everybody. But key, as I mentioned earlier on, is the community ownership. We want everyone to believe that we can eliminate malaria, and this is the time to do it. So every intervention that is made available to you, use it.
We're grateful, and of course, we hope to see you after the 16th, you say? Definitely, we'll definitely have a conversation when that report or strategy is out. Dr. Prapra, thank you so much for spending some time with us. And